UnitedHealth Group is making a lot of money from the federal government by making patients appear sicker, at least on paper. They're doing this by piling on medical codes.
Doctors explain a feeling of moral injury, which they said is more than just feeling burnt out. It's kind of being told how to practice your craft by somebody who's financially motivated. So basically, not feeling like you're doing your job with integrity.
So this is a rampant practice throughout Medicare Advantage. UnitedHealthcare is not the only one doing this, but they're the ones that have perfected it.
My colleagues Bob Herman and Tara Bano have been investigating UnitedHealth's grip on the healthcare industry. They recently wrote about how UnitedHealth's push to diagnose patients with more conditions is affecting doctors and patients. We'll hear more from Bob and Tara later, but first, let's take a look at how this works. You may have heard of Medicare Advantage plans.
Whether you're turning 65 or you're looking to switch plans, your UnitedHealthcare representative will make it easy every step of the way.
Unlike traditional Medicare, which is run by the federal government, Medicare Advantage plans are run by private companies like UnitedHealth. These privately run plans are still subsidized by government funds, which is given by the Centers for Medicare and Medicaid Services, or CMS. Another big difference is that with traditional Medicare, CMS pays for each visit or procedure members receive, while Medicare Advantage insurers get a set monthly amount for each of their members, regardless if they receive healthcare or not. To avoid insurers favoring healthier people over those who have illnesses, CMS gives insurers more money to cover sicker patients. CMS does this by assigning risk scores to each patient. A patient's risk score resets annually. During routine checkups and home visits, doctors and other clinicians see if Medicare Advantage patients still have any of their ongoing health issues, or if they've developed new ones. Doctors will then check off medical codes in the patient's file. At the end of the visit, the patient's risk score is tallied. The sicker the patient is, the higher their risk score, and the bigger the check insurers receive from the government. Health issues like diabetes, chronic kidney disease, and depression are assigned a code by the government. Each code equals a certain number of points, and they are very specific. For example, in 2024, there are 7 categories for certain types of cancers. The cancer categories carry scores that range from a low of 0.186 to a high of 4.209 for severe cancers. Let's take a closer look at how risk scores are calculated. Betty and Tina are both 75-year-old females and live at home. With these demographics, their baseline score is 0.465. Betty does not have any medical conditions, so her risk score stays the same. But Tina has type 2 diabetes, heart failure due to chronic high blood pressure, and active breast cancer. Adding those up gives Tina a risk score of 1.219. Generally, the insurance industry thinks that every 0.1 increase in a patient's risk score roughly works out to $1,000 in annual payments from the government. Now, there are a lot of factors that can also affect payment, like the type of plan the patient has, the county they live in, whether the person is poor and therefore eligible for Medicaid, and if the person lives in a nursing home. But all other factors being equal, UnitedHealth would get reimbursed roughly $4,700 a year for Betty and $12,200 for Tina. You can see the problem here. This system incentivizes putting in as many codes as possible to get the most money.
Doctors told us that UnitedHealth managers set this troublesome expectation that someone's risk score, the number that's pegged on their forehead, this is how much they're worth, this is how many conditions they have. That score should only go up and not down. It makes sense kind of intuitively, as someone gets older, they're going to have more conditions. That's not always true.
On top of this, UnitedHealth Group has the largest collection of doctors in the country. About 10% are employed or affiliated with the company under their Optum umbrella. So not only are they the largest insurance provider, they also run many of the clinics that their members go to and can influence many of the doctors seeing these patients. Checking off codes takes time that could be better spent interacting with patients. Some doctors have also left Optum clinics, in part due to frustrations with the coding system, which causes patients to lose their doctors. Some patients are also seeing codes for conditions that they don't recognize in their chart.
Some of the codes were conditions they may have had at one time, but no longer had, and the code was just never removed from their record. So one example of that might be a cancer. Maybe they've been in remission for 7 or 8 years, but the doctor has coded that they have active cancer. That's a big one. Doctors said this can often harm the relationship with patients. So even longtime patients, maybe patients they've had been treated generations of the same family, so they've known them for a long time. But they said those patients will call them back and say, wait a second, why does my medical record say I have chronic kidney disease or active cancer or opioid use disorder? And they'd have to have kind of an awkward conversation and explain, this is the way I'm instructed to code. It affects how I get paid.
And ultimately, this affects all of us, the taxpayers.
For every code that comes in that isn't true or is exaggerated is money that is coming from the government, which is us. It's taxpayers. It's money that's coming out of our paychecks that is going toward insurance companies. And, that's money that could be used for other stuff. And it's going for a purpose that is, obviously, it's just for the profit of an insurance company. And it's not even fully reflective of maybe the conditions that someone has.
When Bob and Tara reached out to UnitedHealth for comment, they said its providers make independent decisions and the company expects them to diagnose and document patient information completely and accurately in compliance with government guidelines. So what's being done about this? The government has put in measures to rein insurance companies in. In 2024, they implemented a new coding plan that removes some problematic codes, and they're doing more audits. But ultimately, these won't completely stop insurers like UnitedHealth from profiting from the system.
As Tara and I reported this out and spoke with doctors, there were just certain conditions that ultimately were more gameable. There's more things that are open to interpretation. There's a lot of ways where insurance companies can say someone has something and it can sound appropriate and sound like good documentation. But ultimately, doctors have said they felt like what UnitedHealth was doing was not the right thing to be doing. There's a large difference between appropriately documenting the conditions someone has and being paid for that versus just lumping codes onto patients and racking up as much money as possible. And I think that's where things have been diverging, at least in the past several years.
For more of Bob and Tara's story and to read their investigation that they did with our colleagues Casey Ross and Lizzie Lawrence, go to statnews.com or click the links in the description box below.